Torre, Assistant Scientific Director of the CIHR Institute of Population and Public Health, to provide you with some background on healthy cities and implementation science. Over to you, Marisa.
Merci, Kim. Thank you very much. And thank you very much, everybody, for joining today. I'm just, as Kim said, I'm just going to say a few words background on this opportunity, including some of the context within which we came up with this Tri-Council idea for a funding opportunity, as well as what we are meaning by implementation science. So next slide. So probably most of you who are on this call are quite aware of this statistic already, but a big part of the rationale for this opportunity is the fact that in Canada right now, about 82% of the population live in cities. And this is actually a phenomenon that we're observing not just in Canada, which is highly urbanized, but in most parts of the world. And in fact, the WHO and the UN declared that by 2050, the expectation is that about 70% of the global population will live in cities. So this is a Canadian issue, but also one of global importance. Next slide, please. So apart from some very strong genetic predispositions, really our postal code, we're increasingly having evidence from the scientific literature that our postal code is one of the strongest predictors of our health and well-being. Next slide. And in fact, our environments not only dictate certain health influencing exposures, such as air pollution, but our environments very strongly also drive behaviors. So for example, as we know, walkability and the bikeability of neighborhoods can influence the amount of active transportation that people engage in, which in turn has been shown to relate to overall levels of physical activity. So we're increasingly understanding the very important role that environmental characteristics play in influencing behavior, and then those behaviors in turn either positively or negatively impact our health and our well-being. Next slide. Next slide, please. Merci. So we have a solid foundation of understanding that our environment shape our health and well-being, and now we have to understand better what are those factors within our environments that we need to study more closely to understand how to create interventions that will actually get us to a healthy and a health-promoting environment. And when we talk about environments, we're talking about the social, political, natural, and built environments. Next slide. So this brings us to what we are talking about, or as the focus of this training opportunity today. So as we are, again, most people on this call will be aware, for the past 30 years or so, we've done a great job in researching and identifying the characteristics of cities that support and promote health and well-being. And we have a solid foundation for the evidence and evidence for what factors are most important, such as air quality and food availability, green space, sustainable housing, transportation systems, access to health and social services, diversity. But where we have a gap right now in Canada and elsewhere is a capacity to study and understand how to build on this evidence base and how to design, implement, and sustain interventions to create those factors that in turn will create urban environments that can improve population health, well-being, and equity. So when we say implementation science, we're talking about the solutions-based research focused on studying what works, in which context, for whom, and how. It's about integrating and adapting tested interventions to different settings. Next slide. Now I am going to hand it over to my colleague at NSERC to speak a little bit more about the research training platform.
So good afternoon, everybody. So CIHR, NSERC, and SSHRC are jointly funding a national Healthy Cities research training platform to develop an interdisciplinary intersectoral training initiative that will generate cutting-edge knowledge and build capacity for implementation science and solutions-based research. So this tri-agency initiative is modeled on the former CIHR Strategic Training in Health research program, the existing NSERC collaborative research and training experience, and the SHRC partnered research training initiatives. The goal of this funding opportunity is to deliver a national training initiative focused on building capacity among Canadian researchers to engage in high-quality, impactful research on how to design, implement, and scale innovative, solution-based interventions in a variety of urban contexts. Next slide, please. So the total funds available for this initiative is $5.1 million, and of that $5.1 million, $150,000 is available to fund up to 6 developmental grants. The developmental grants of up to $25,000 per grant will be offered, if requested, to successful applications at the letter of intent stage. Developmental grants are meant to help fund activities that contribute to the further development of a grant application, such as partnership funding, or partnership building, conducting environmental scans and consultations. $4.95 million is available for the full application, which is enough to fund 1 grant. The amount may increase if additional funding partners participate, and the maximum amount for the grant is $825,000 per year for up to 6 years. Next slide, please. So the various objectives of the training program are what we'll go over now. We'll start with it's designed to build capacity across Canada among doctoral, postdoctoral, and as appropriate master's level trainees and decision maker partners to further solution-based research and the science of implementing innovative, outcome-focused interventions that promote healthy, resilient, sustainable, and equitable cities. Another objective is to incorporate diverse training approaches into innovative and cross-sectoral training programs that improve the mentoring and training environment for trainees. The training initiative should include a significant emphasis on real-world experience, experiential training, and professional training aimed at working with implementation partners and by leveraging components of the broader HCRI. Next slide, please. Another objective is to deliver interdisciplinary, intersectoral training programs in order to support the development of collaborative team research. Training programs must include experienced researchers and mentors from different disciplines to address major healthy cities issues, and or research challenges. The program must involve a collaboration of researchers working in areas that span across a tri-agency mandate to bring together researchers from the health sciences, the social sciences, the humanities, and the natural sciences and engineering. Further, the objective is to develop a community of mentors and experts, including researchers and practitioners, in designing and implementing innovative solution-based interventions in variable urban contexts. Next slide, please. Further, we want to establish opportunities for trainees and other training initiative participants to develop partnerships and collaborations across jurisdictions, be they municipal, provincial, federal, or Indigenous communities and sectors, academic, public, private, and nonprofit. The training model should help establish and strengthen partnerships between trainees and a wide range of institutions, and in particular, leverage the partnerships and collaborations of the HCRI, which is the Healthy Cities Research Initiative. Finally, it should develop diverse and well-rounded trainees and contribute to their career trajectories and research outcomes by enhancing interagency networking. So now I will hand it over, back to Marissa.
Hi, everyone. This is Katerina from SHRC. Thank you, Teresa, for the first part of the objectives. I will be speaking to the community about the eligibility. So as we can see on this slide, let's talk about the letter of intent. In order for the letter of intent to be eligible, the application must be submitted by a team, one being identified as the nominated principal applicant and the remaining members to be identified as principal applicants. The nominated principal applicant, or the NPA, must either be an independent researcher who is appointed at an eligible institution or is an organization with a research or knowledge translation mandate, and will need to undergo a financial assessment process and an eligibility review to meet the requirements to administer grant funds, and will be required to sign a funding agreement with terms and conditions determined by CIHR. As seen on this slide, letters of intent must include 3 co-leads, or 4 co-leads if the NPA is an organization. So the breakdown of that goes as follows: a nominated principal applicant, 2 principal applicants, or 3 principal applicants if the NPA is an organization. The principal applicants must be independent researchers and appointed at an eligible institution. Among the co-leads, there must be a researcher from each of the 3 fields, such as natural sciences and engineering, social sciences and humanities, or health sciences. Finally, no other participants need to be identified at the letter of intent stage. Moving on to the full application stage. Once successful, after the letter of intent stage and keeping the same requirements mentioned from that stage, there are additional requirements for the application stage. A minimum of 3 co-applicants who will provide hands-on training opportunities related to implementing interventions must be identified. The program must serve a national purpose and also be national in scope. The team must represent at least 3 Canadian provinces or territories. The NPA, all the PAs, and the co-ops are required to complete one of the sex and gender-based analysis training modules available online through CIHR Institute of Gender and Health. And finally, applications involving research with Indigenous communities must include at least 1 applicant who self-identifies as Indigenous, for example, First Nations, Inuit, or Métis, and/or applicants who can demonstrate their experience working in an Indigenous research environment, which may include Indigenous living experience, addressing power imbalances, and cultural safety. Applicants must submit a 1-page other attachment describing how their team meets this requirement. Next slide, Julien. Thank you. So let's discuss the conditions of funding. This slide and its content are a bit on the heavy side, so I will do my best to cover this as clearly as possible, but as I move through, my colleagues will likely fill in the details, or you're free to ask questions at the end. So to begin, the applicant must consent to the use and disclosure of LOI and full application and nominative information for relevance review and funding decisions by all 3 agencies at the time of application. At the letter of intent stage, the teams funded will be required to send 3 co-leads to attend a mandatory strengthening workshop to be held in Ottawa in February 2020. 2 other team members are encouraged to attend for a total of up to 5 members. However, the other 2 possible team members who would be attending this workshop do not need to be identified in the LOI application. The funds for this strengthening workshop must be set aside from the development grant itself. There are 3 purposes to this workshop. The first is to provide applicants with more information from the funding partners on how the full applications will be evaluated. The second is to provide applicants opportunities to network with key collaborators and partners. And the third is to provide an opportunity for applicants to discuss ways of working together to form the best possible training initiative in Canada. Now, let's look at the full application stage. Funds can be, no, sorry, Julien, go back a slide. I took a pause there. Thank you. Funding can be used for graduate students' stipends. The training initiative must adhere to the following. 1, select participants in a transparent and fair manner that do not privilege geographical placement or the institutions at which the grant holders are based. Efforts must be made to ensure equity, diversity, and inclusion. Participants should represent health, social sciences, humanities, and natural engineering sciences. Dedicate funds to support travel, accommodation, and meals to attend conferences, seminars, and other training events, including opportunities to meet with international peers and exchange between institutions. A maximum of 20% of grant funds can be allocated to these activities between the institutions. Number 3, dedicate funds to develop and disseminate training materials and knowledge exchange resources. The fourth point on the slide, ensuring training material are openly accessible outside the training initiative such that graduate-level students, implementers, and community development professionals who are not formally part of the Healthy Cities Research Training Platform can benefit. The fifth point is to facilitate collaboration and links to the broader Healthy Cities Research Initiative. And I'll explain what this means briefly, but in the next 2 slides, my colleagues will talk about the research initiative in further details. So what this entails is to build initiative and opportunity to leverage and cross-pollinate expertise and training opportunities. This means collaboration across the different disciplines. Also, the Healthy Cities Research Training Platform team will be represented and will actively participate on a Healthy Cities Research Initiative Coordination Council, once it's established, to facilitate collaboration in the organization of the Healthy Cities Research Initiative annual meeting. Finally, this also means to create linkages and provide learning opportunities for future grantees of the Healthy Cities Research Initiative. So just an aside before we touch on the research initiative, I want to mention reporting. The nominated principal applicant will be required to submit a progress report for long-term grant holders, so for 5 or more years, in the 3rd year of the 6-year grant, so that would be between 2022 and 2023. And this will summarize the outcomes on how the training initiative is meeting its objectives of the funding opportunity, and it'll also describe how the grant funds were used. All reports will be shared with partners supporting the grant. If the objectives of the funding opportunity are not being met, a decision to terminate funding can be made at this stage. Of course, the nominated principal applicant will be required to submit an electronic final report to CIHR, NSERC, and SSHRC, which will be made available on ResearchNet at the beginning of the grant funding period and can be filled in as the research progresses. So we'll move on to the next slide, and I'll pass the mic back to my colleagues.
Hi there. Thank you very much, Katerina. This is Stephanie Kovala speaking from CIHR. As one of the conditions of this opportunity, one of the conditions of funding, is to facilitate collaboration and links to the broader HCRI, or Healthy Cities Research Initiative, we wanted to quickly point you to where you can find more information on this. So the CIHR Healthy Cities Research Initiative is a major initiative at CIHR, and we have a website which explains the term of this initiative, the different components that are within it, a summary of the background and the objectives, and really the purpose of this slide is just to point everyone to this as a resource for where you can find more information on this initiative, given that we are asking applicants to facilitate collaboration and links with this initiative that CIHR is running. Next slide. And as a part of facilitating collaboration and links to the HCRI, one of the conditions of the Healthy Cities Research Training Platform is to host a Healthy Cities annual meeting. Given the interdisciplinary and cross-sectoral nature of the training platform, we envision that the Healthy Cities annual meeting will have participants from the engineering field. It will include urban planners, healthcare providers, a range of individuals and professionals working in the Healthy Cities space. It should also include other grant recipients from the broader Healthy Cities Research Initiative. Next slide. And with that, I'll pass it back to Katerina.
Thank you, Stephanie. So let's discuss the review process and evaluation. CIHR will share eligible Healthy Cities Research Training Platform applications with NSERC and SSHRC at both stages of the review for purposes of selecting one awardee. Relevance of the review process at the letter of intent stage, CIHR, NSERC, and SSHRC will perform a relevance review to identify applications that are in alignment with the objectives and research areas of this funding opportunity. Applications that are not deemed to be relevant will be withdrawn from the competition. To discuss the review process, peer review will be conducted in accordance with the peer review policies and procedures guidelines. The peer review panel will include representation from across the health sciences, social sciences and humanities, and natural and engineering sciences. So let's discuss the evaluation criteria. Let us look to the column on the left for criteria that will be used at the letter of intent stage. Vision and strategic framework. The three co-leads clearly articulate a vision of what the training initiative will achieve and a high-level strategic framework for achieving this vision. Leadership, team, and capacity. The three co-leads represent all three agencies, so CIHR, NSERC, and SSHRC, thematic areas, and demonstrate their capacity to lead and deliver a national, pan-Canadian, tri-agency training initiative. So evidence of experience in training, partnerships with the national, provincial, and local research or implementation partners, etc. Experience in implementation science and solution-based research. The three co-leads have demonstrated experience in planning, implementing, and evaluating innovative solution-based interventions in a variety of urban contexts. Equity, diversity, and inclusion. Appropriate considerations related to equity, diversity, and inclusion in the research, training, and knowledge translation activities. Gender and sex considerations. Appropriate incorporation and justification of sex as a biological variable and/or gender as a social determinant of health where applicable. Finally, research themes. The challenges to be addressed are associated with Healthy Cities research priorities. Now, looking at the right-hand column for the full application stage, the criteria are as follows. Research Training Initiative, Vision and Approach. This takes into account the feasibility of the approach, the relevance to which the objectives are met, and much more. I encourage you to read our ResearchNet page that goes into the vast details of this criteria. Applicants, or applicant. This is where the capability of the team will be assessed. Again, I invite you to consult our funding opportunity page on ResearchNet for the bulk of the details. Environment for research is mostly focused on the training, mentorship, and suitability aspects of the proposal. Impact of the training initiative is more or less self-explanatory. This is focused on the potential of strengthening the research capacity across Canada. Of course, the bulk of the details are presently online on the ResearchNet page. And lastly, for applications including Indigenous research and Indigenous health research, there will be a set of criteria to be met, which are outlined on the funding opportunity page on ResearchNet. So we'll move on to the next slide. And here, this is pretty self-explanatory. You can see the deadlines for the letter of intent. So the first deadline is the letter of intent, which is on December 10th, 2019. The anticipated notice of decision will be January 31st, and the funding start date will be February 1st, 2020. In the next column, we can see the full application deadline will be August 27th, 2020. The anticipated notice of decision will be on November 29th, 2020, and the funding start date for the full grant is December 1st, 2020. So I'll pass the mic on to my colleagues for the last few slides.
Thank you, Katerina. So back to Kim from CIHR. This slide speaks about the how to apply to this competition. This is a joint funding competition being administered through CIHR's ResearchNet portal, which is why we want to ensure that everyone on this call understands the needs. You will need to have a ResearchNet account. a CIHR PIN, and a Canadian Common CV to be able to apply to this. Should you have any questions about the application process or the funding opportunity, you can look at the ResearchNet page for this funding opportunity or forward your inquiries to the contact centers, which information are on this slide but also on the following one.